In this world, we all have limited time. Some of us know when the time is up, whereas some of us don't. But what is most important is to make the best meaning out of the time that we have. As advanced practice nurse in palliative care, I see patients with end-stage illnesses. Palliative care is basically the care that is given to patients with life-limiting illnesses to improve their quality of life. So I help to manage patients with their pain and also see patients at the day care clinic at HCA Hospice care. So when I first started, my friends were like, "Why did you go into palliative care? It's so sad." And that over time also made me feel very sad. But somehow it all changed with this encounter with a doctor who was also a mentor. It was the change in perspective that brought a deeper meaning to the work that I do. One of the things that she shared was that palliative care is not about dying. It is about living meaningfully with whatever remaining time that you have. And once I saw the meaning in the work that I do, I saw greater value in all the things that I was doing for the patient and the family. I fondly remember an elderly man. He was actually in his 90s and he was living alone. During one of the visits, he told me, "Kahvidah, is it alright if I have a meal with you?" I was surprised with the request because we are there to provide clinical care and not to have meals with our patients. But for this man, I had to make that exception. He probably had not had that meal with anyone for many years. So I said yes. And we had a very good meal together. A few days later, our dear gentle elderly man had a fall at home and he landed up in the hospital, and subsequently after a few days he passed on. Most of my patients, they tend to reevaluate a lot of things at this point of their life. The conversations that I have with these patients also get me to reevaluate my own values, my principles and my morals, so that I can reshape my thinking and bring a different perspective to my life. This has also got me not to take things for granted, even the simple things such as spending time with family. One of the visits that I'll always remember was my visit to this young mom. We were helping to control her pain. So once she was a bit more comfortable, she held out her hand. The moment I touched her hand, I felt the warmness. That warmness I will never forget because it reminded me of my late mom. My patients have taught me so much. I see how strong they can be dealing with whatever hardships they're going through, and that truly inspires me.